Hi everyone, I'm experiencing some technical difficulties on Canvas, so I'm going to try to record this and upload it. I do apologize if the video isn't clear or you can't hear me so well, so just bear with me. I wanted to just introduce myself. I am Monica Martin, and I basically did a project, evidence-based implemented project on a welcome orientation, which was basically giving extra information to my patients about my skilled nursing facility and having them have a more effective transition into the facility. So basically, patients lack knowledge. They come in and they don't have the same knowledge level that we do or educational levels that we do. So basically, the evidence shows that by improving communications and knowledge, you're going to improve patient-centered outcomes. So basically, what I ended up doing was I ended up creating a welcome to my facility orientation handbook that we gave out to patients on half of the rehab unit, and the other half we did not. And we followed up about 48 hours later to make sure that the patients were aware of the information and that they had retained it and that they had a overall good customer service experience when they came into our facility. So we then took an assessment tool that we had created, asking them 4 questions to make sure that their transition went smooth and well and see if there was anything we could have done differently or helped them with. We re-evaluated this data and then we applied it to practice and made sure that the patient had an overall better customer service experience, which they did. My data did show that they had an overall greater customer service experience, that they were more versed in what to do, and it actually showed that the patients who were on the side that got the orientation didn't have as many rehospitalizations, believe it or not, as the ones who didn't. So they were given a whole bunch of different knowledge about the facility, such as hand washing, dining hours, meal choices, visiting hours, just basic information in the facility, and it made them feel like they overall had a better understanding of the process of what they were going to be doing in a skilled nursing setting and how their rehab was going to take place. So that was my project. It did improve customer satisfaction for the post-acute care patients. The welcome booklet and the post-assessment tool that was created by myself. We had created it from the customer service committee, and we had implemented it into the facility, and we had gone along and assessed it after we had used both of those tools. They both seem to work well, so we'll continue using those in the future, and we will continue with the welcome orientation booklets. But on that note, I wanted to review with you how these components of this evidence-based implemented project affected my MSN professional development, basically. So by implementing this project, I did meet the MSN Essential for Professional Practice 4 by integrating clinical experience and advancing my knowledge for leadership. We translated the scholarship into practice. We did this through the project. We defined a problem. We developed a evidence-based implemented project, and then we translated the data that we had gotten through the research and through the customer service committee into actual application and practice. So we actually did use the information from the research level all the way to touch the patient. So that was the essential number 4. As far as MSN essential number 7, that was applying communication, cooperation, and collaboration, and developing a healthcare setting or healthcare team. I did that through the collaboration of working together with the doctors and all the different departments and the customer service committee and the supervisors to implement the project. Learned that greater teamwork and how it will impact the patient care outcomes. So we did use that collaboration through teamwork and evidence-based research project. The last one was the master's nursing degree, essential number 8, which was developing a broader knowledge base. I think we all kind of done that through the use of looking up the research and taking that research and putting it into a project on paper, and then taking that project and then actually implementing it and have it touch the lives of a patient, and revisiting the data and seeing what it says, and reevaluating it and either recommunicating to the patients or the team, and working together to make the patient experience greater I think that's what we are looking for, whether we have a project on orientations and welcoming patients, or having a better transition at the bedside, or all the different projects that we worked on. It was all about the clinical outcome of the patient, and I think the projects kind of all gave us, or gave me actually, a greater knowledge base of what it is to actually take it to the next level on a master's degree nursing level. So I do feel that the project was able and did allow me to meet the criterias required for the class, and it was very exciting. It was very interesting to learn and to actually see how you actually take research and you put it into a project, and how you actually implement it in a clinical setting, and actually getting that clinical experience from taking that research from one level to the next. So that's what I learned. I also did learn that taking that research, just not in this project, but in all my quality assurance performance improvement projects, to take the most recent research and put it into practice was actually beneficial. So it was interesting to see that also. So again, I'd like to take the moment to thank you all for working with me, and all of your feedback, and all of the information that you gave me, and for spending week after week reading my project and writing to me. And I look forward to working with you all in the next semester. Thank you.